Welcome back. It's 8:39, and it is the end of Breast Cancer Awareness Month, and we are joined this morning by Dr. Ann Koberman of Overland Park Regional Medical Center. She is a breast surgical oncologist.
Thank you so much for being here, Dr. Koberman. We hear about Breast Cancer Awareness Month. We have heard early detection is important, but can you explain what difference it makes to find a cancer early?
Absolutely. So the most important thing about breast cancer and most cancers is if we can find it at early stages, the outcomes are significantly better. So survival, long-term disease free years. So what we really want to do is identify cancer at its earliest stages so patients have the best opportunity for longevity.
Yeah.
And I'm almost hesitant to ask this next question, Dr. Koberman, because I know there's been a lot of debate over the recent years. What are the latest updated recommendations for screening?
So the good news is I know it's super confusing because it seems like it changes all the time, but it's really not that different. The most important thing that we're really focusing on now is we want to get women in around the age of 25 to meet with them and identify what their individual risk factors are, because we're really trying to tailor screening to individual patients. And so to identify family history risk factors, personal history risk factors, average risk women, it's still going to be mammograms starting at age 40 and clinical exams by their doctor annually. But there are some women that may benefit from earlier screening, either starting mammograms earlier or other modalities, whether that be MRI or ultrasound.
Is there harm in going in for a mammogram before you're 40 just to kind of, if for nothing else, get a baseline of
It's
what
not
sort of tissue you have?
dangerous. It's a very small amount of radiation, about the same amount you get from eating a banana. So don't be afraid of the radiation. But the difficult thing with mammograms in very young patients is our breast tissue tends to be very dense when we're young, and it gets less dense as we age. So the mammogram becomes less helpful the younger you are because it's difficult to see through the tissue.
Interesting.
Wow. And I've been lucky enough, Dr. Koberman, to get to know Dr. Amy Patel at Liberty High. I'm sure you know her. And I know she helped pass legislation that made 3D screening widely available. Not for everybody, but for way more women than they used to be. And that makes a difference, right?
Absolutely. So in talking about dense breast tissue, you're trying to look through all the tissue. So 3D allows us to kind of look through slice by slice. So instead of trying to look through the entire book, you're able to separate it by chapter. And so you can look through the tissue a lot easier. And so both Kansas and Missouri do have legislation that require your insurance companies to cover 3D mammograms. So we absolutely recommend that.
Wow, what a great opportunity for so many women.
Yeah.
Thank you so much for joining us this
Absolutely.
morning.
Thank you for having me.
And